Hello, my name is Tracy Mungo, and I'm here to conclude my presentation to you for the topic, Stressing Me Out. To continue on with my presentation from where I left off at, I want to talk to you today about the different types of stress. There's physical stress, and that's the type of stress that affects you physically. For instance, the type of stress that I deal with in my day-to-day life as far as my professional career and people in my line of business, we have a lot of anxiety. We can experience a lot of anxiety. We can also experience insomnia. These are just the physical type of stress that we may deal with. For instance, I'm responsible for making sure that members get the proper medical care through their doctors and hospitals and clinics. I'm the person who manages those doctors' offices and the clinics, making sure that they're following our policies and procedures. So it's very important for me to make sure that the members are getting the services that they need when they need them. My position at my job, I'm a provider contractor. So I go out and I recruit the providers, I install the contracts for the providers, and I service the providers once they become participating. So I hold a lot of responsibilities with my job. So a lot of times I'm dealing with the physical stressors of anxiety. Sometimes I'm dealing with insomnia because I've thought of something that I should have done the day prior or that earlier that day. So I'm up all night trying to figure out what it is I need to do, and if it's something I can do at home, I might even jump on my computer. So I work a lot of extended hours in my profession. So a lot of times, again, I can deal with migraines, backaches. Those are just some of the physical stresses that I have dealing in my line of business, or someone in my line of business may have to deal with. Then you have the mental stress. And again, in my line of business, I tend to worry a lot because I, again, want to make sure my members are getting the proper care and treatment that they need from the providers, and that the providers are following our policies and procedures. And I also want to make sure that the providers have everything that they need, because I'm a liaison for the providers as well. So a lot of times I'm dealing with guilt because I may have to tell a provider no about something that they may very much need. For instance, I negotiate their rates and their raises with us. So a lot of times I might have to tell them no. I deal with a lot of fear sometimes in my job because I don't want to do something that may harm a patient. So I need to always make sure that I'm focused and I'm having that open line of communication between me and the providers. I'm going to stop this video in order to make sure I don't lose it. Thank you.